The federal government is taking aim at e-cigarettes. For the first time, the CDC's anti-smoking ads will warn consumers about vaping. Joining me now, Dr. Pat Salber, founder of the website The Doctor Is In. Dr. Pat, welcome to the show. I want to show first the ad itself, or one of them at least, so you can get a sense of what the government is doing. So you see a picture of a woman here, and she's quoted as saying, "I started using e-cigarettes, but kept smoking right up until my lung collapsed." Now, Pat, a lot of people tell you this is a great way to stop smoking. Is it?
Well, you know, there actually isn't any good evidence that shows that using e-cigarettes as a nicotine delivery device helps people stop smoking. In fact, some recent studies make it look like that smokers who use e-cigarettes are less likely to quit than smokers who don't.
Unbelievable. Well, you know, we've reported extensively on this show about some of the health impacts, health problems, especially for children who get burned because they break open one of these e-cigs and the nicotine inside, the material burns their skin. Are there other health drawbacks here?
Oh, sure. I mean, beyond burning your skin, nicotine is actually a neurotoxin, and as little as a teaspoon of the liquid nicotine that people have that they keep in bottles to refill these devices could actually kill a child. Now, there's been no deaths yet, but there has been a remarkable increase in the number of calls to poison control centers across the country reporting toxicity poisonings from the nicotine, the liquid nicotine.
And we've had some of those folks on our show, the people who run those poison centers who take calls in the middle of the night because some kid rolled over one of these things in their parents' bed. It's sort of appalling. Right. I think I'm the only person on this network who does not like e-cigarettes, and I think it's a situation where money talks. This is a $2.5 billion industry right now. They say they should not be harassed by the government. They say that the government has no studies to prove that it's a problem. How do you answer that?
Well, I think one of the reasons why we have no studies is because we haven't had regulation. I mean, it's a relatively new product, but if they were regulated as tobacco is, they would have to prove, you know, their claims. They would have to, particularly if they want to be classified as a officially as a tobacco cessation product, they have to do studies to prove that it's safe and that it works. So I actually think that when you're inhaling a toxic substance, even though it doesn't have all the same carcinogens as cigarettes, that there is strong reason to believe that these products should be regulated.
On another topic, do you think that these ads will work? I mean, how many people listen to the original smoking cessation ads? I don't know. Is this the kind of thing that will really dissuade people?
Sure, they actually studied it. The initial CDC ads that, of course, didn't include e-cigarettes but were aimed mainly at traditional cigarettes actually were responsible for about 100,000 people quitting for at least 6 months. And another 1.6 million people who attempted to quit. So we do know that these kinds of ads work. They're not the only thing that works, but they're one thing that has been proven to help people stop smoking.
Dr. Pat, before you go, give me a couple other ways to stop smoking if I'm thinking about it right now.
Well, you know, I think that using some of the approved stop smoking devices, such as nicotine patches and nicotine gum, they all have efficacy. I think the other thing is not being around people who are smoking. So if all your friends smoke, it makes it very difficult to quit smoking.
Right.
So trying to change your milieu, so to speak, are all things that work. And then there are counseling programs online that also have been shown to help. But it's not easy. Nicotine is a highly addictive substance.
That's right. And I use the patch. That's what worked for me. Dr. Salber, thanks for coming on.
Sure, my pleasure.
And